Hi, I'm Dr. Allison Cole, sleep medicine specialist and bona fide chronic insomniac. Welcome to the Sleep is My Waking Passion podcast. Remember, knowledge is empowerment, and if applied correctly, it can help you biohack your way to a better night of sleep, just like I did. Okay, hello everyone, and welcome to Season 3, Episode 1. I am kicking the season off with like a superstar guest of mine. I have a very special guest. This is Marissa Sharkey. She is a registered dietitian. We were previously working together for a number of years, taking care of patients who were critically ill. We worked side by side during COVID. It's been a very crazy time of evolution for the both of us. Marissa now are you still focused on helping nurses? We had talked about how you might be morphing a little bit, your message, but one of the things that you've been most passionate about is really assisting nurses in optimizing their nutrition and using nutrition really as a way to help manage the burnout feelings that, quite frankly, many of us are having who are doing day-to-day healthcare.
Absolutely, yes. So I'm still focusing on working with nurses and helping them create these balanced but sustainable health habits that are actually benefiting them and that they value. So it does help them stay in the field long term. And you're right, burnout is a huge problem right now, especially post-pandemic for nurses. So anything that I can do to help them help themselves is beneficial overall.
Now, Marissa and I are very seasoned, and both of us have pivoted specifically because of how we felt, like how we got to the point of just feeling like it wasn't something that was sustainable or healthy for us long term. And this is ultimately what this podcast is about. Yes, we talk and we focus about sleep, but Marissa and I were chatting, and she brought up an observation that you had working with your clients, which is that so many of them really did not see themselves with a positive light. They essentially had, a body image issue. They really didn't like their bodies. They didn't really recognize or appreciate their bodies in a way. I think that's being healthy and being mindful of that.
No, I mean, you nailed it. I mean, I think, it's body image is a very complex issue, but it is something I've seen in a wide variety of patients, and it stems from very young to even as you get older. It doesn't miss anybody.
So, as we get into what we specifically mean about body image, one of the things that we were chatting about was I was like, I wonder if how this affects people's sleep quality. Is there any information about this? Because this is not something that we really talked about other than when you're in training and you're in sleep fellowship. We delved a little bit into folks that have true eating disorders. So if anybody is out there listening and they get very triggered by talking about eating disorders, this may not be the episode for you. So I'll preface that. We are not trying to offer medical advice here, but we're just here having a discussion and bringing up a topic that both of us, in having kind of done a deep dive into the literature, have realized there's just not that much literature on, but I think it's worth considering. And so we wanted to bring up kind of these issues related to how body image might impact sleep. And the bottom line is all the data that we're going to talk about is really a lot of it's what they call cross-sectional. So they're taking a group of folks and they're following them over time, and we're getting correlations. So this is not, again, an equation. You plug in A, you plug in B, and then you get C. This is really about making associations, but I think really relevant associations, because we know that we have an epidemic of folks that are not sleeping well in this country. That is not new. What really blew my mind was the fact that we also happen to have an epidemic of people who sort of don't like themselves, either how they look or how their bodies look. So you're taking two epidemically large problems, and then we're discovering that there are some relationships, both from the perspective of how you sleep affecting how you perceive yourself, and vice versa if you don't have a good sense of who you are. And basically, if you don't love yourself, that kind of starts to affect how the quality of your sleep is. So the other thing I wanted to bring up, because, and Marissa, I know you're going to speak to this, the bottom line is that some of our most vulnerable people, if you would agree, are adolescents, are teens. These are people that really these are essentially kids, and they're in this world of social media and TV and expectations and peer pressure and all these things. And they're also incredibly sleep deprived. I've talked about that on the show before. We know that they're the most sleep deprived, basically out of all of us, based on their schoolwork, their natural physiology, and their desire to kind of be up a little bit later and sleep in a little bit later, which again is a part of our normal physiology. And then conversely, they also tend to really have some body image issues. So let's first try to understand, what do we mean by body image? So, Marissa, I'm going to hand it off to you. When we talk about body image, can you sort of define that for everyone so they kind of understand the construct that we're working within?
So, body image, it's pretty much how you perceive yourself, and in your physical form, meaning, how you see your body, how it looks, how it feels, the function, just overall what you see, not anyone else's point of view, it's yourself. And that can be skewed. It could be, as far as like, I think I'm bigger or smaller than I actually am, and I don't like
Mhm.
it. And that can also infuse feelings and thoughts and emotions surrounding that. Or it could just be, okay, this is how I see myself. But body image is a very vast and complex topic overall.
And the prevalence, if we getting into some statistics, this was eye-opening to me. This was a study that was carried out. They followed people for 15 years. So it was a very long time. They had over 1,000 folks that they followed. And these are people essentially that they were following over time, both male and female, into their young adulthood. And I was blown away by this. 50% of females and 26% of males were dissatisfied with their bodies. I mean, this is really a serious issue. And what I would say is, I'm going to come from my perspective just personally. I can say, because we were just chatting about this, I look at like old pictures of myself or something where I would look at that picture and be very critical, like, well, I don't look as thin as I should have looked, or, I look like old, or I don't like how my hair is, or like there's something that I'm picking out of that picture that I'm super critical of. And in
Hmm.
retrospect, now decades later, I go back and I'm like, I looked okay. I looked pretty good. I don't know what I was like, why did I perceive myself in such a negative way, you know?
Why am I like this?
Yeah, and as it's like, it's really like a dysmorphic kind of attitude towards
Hmm.
yourself. And my mind was blown having looked at that, and now like having two little girls that I'm raising, and I'm like, oh my goodness, how do I navigate this with them? How do I
Right.
get them to really try to have a baseline sort of appreciation and love of who they are, and not a focus. And sometimes it can be really subtle. Like my
Hmm.
mom being of Korean descent, she can sometimes be, anybody who's an Asian mom may agree with my feelings on this, but they have their tiger mom tendencies when it comes to education. But they also can be a little critical of kids, and I certainly got my fair share of it growing up. And I'm not blaming her for that. I'm just saying it's part of her culture. But I see her sometimes being like, well, you know, Lily's growing up so nicely. Her belly doesn't stick out as much. She looks more like a little
Mm.
girl. And I'm like, please don't say that. Please zip it, zip it, zip it. Let's not talk about that, because I don't want her to get that ingrained in her head, like how I look is somehow tied to my worth. I don't know if you've experienced that. I mean, it's definitely not just an Asian mom thing, but I could say that that was my sort of personal experience with it for sure.
No, absolutely. And that's completely valid, because think of all the different avenues where we receive messages about our body image and how we're supposed to look. I mean, it's even worse today because we have social media. And
Mm,
as you said, adolescents have more access to social media. So think of like TikTok, Instagram, all those places where everyone's highlight reel is posted. And everyone's kind of looking at them like, oh, they're the ideal. I want to be like that, because if I'm like that, I'm going to be whatever the desired outcome is for that person. I'm going to be valued. I'm going to be loved. I'm going to be adored. I'm going to be famous. And that is a really, really toxic cycle to get yourself stuck into. Because if you keep chasing this ideal of how you're supposed to look, and it just constantly changes too. Like if that look all of a sudden changes and you were going after that look, now you have to go after a new look. It's
Hmm.
it's not realistic. I mean, think about all the body trends that you've seen over the years. Back in the 90s, it was all about super, super skinny. Like they
Like the
used to
waif
call it
look,
like,
right?
yes, they used to call it heroin chic, because they were just super thin and like you could see their collarbone, and there was the low, low rise jeans. Let's not go
Oh
back to that.
God.
Um,
Please keep those
so,
away from me. Nobody needs to see that anymore. Oh God.
um, so that was
Who
the
didn't have a
trends.
pair of those? Yeah, for
Exactly.
sure.
That was the trend. And then it started to transition to, well, now we like a little bit more of a curvier woman. We like somebody with larger hips and a bigger butt and all of this. And not everyone is built that way. So if you grew up through the 90s and today, of course, you wanted to be super thin in the 90s. Now all of a sudden you want to be the complete opposite. How is that realistic to be chasing that, especially if your body is not meant to be either or? Your body's just the way it's supposed to be. Everyone's genetics and body structure are going to determine how you look. And I hate when we make a certain body type a trend, because bodies aren't trends. Let that sink in. But of course,
Bodies are not trends. Yeah. I
we
love
make it
that
that
too,
way.
because it's not even just about your diet or your size or your thinness, for example. Like, and we definitely grew up in the Kate Moss era, like the wafy kind of thing
Mm-hmm.
was like huge for us. Um, but now you have folks that now are thinking at very young ages sometimes, how do I morph myself physically? Because now we have plastic surgery that's out there. There's all sorts of procedures that people do to look a certain way. And some of those could be quite dangerous, especially if they're in the wrong hands. I mean, to alter yourself surgically, especially sometimes you hear about people are pretty young. And I can tell you,
Mm-hmm.
like, how I look like in the 20s is not how I look like now after 2 kids. And, there are things that happen and change and evolve. And like, I can't even
Oh,
imagine
yeah.
if, I had installs and then I had kids and then they were like, you know, my boobs
I
got
can't
much
even
bigger post
imagine.
kids. So like I walk, I don't even know how to walk around, just be whacking people in the face with them or something. Oh, MG, we're so getting
Yeah,
canceled.
that's okay. At least you're honest. I love that about you. And no,
Oh
you're
my God.
absolutely right. Like we live in the era of like, oh, if I don't like this about me, I can change it. Which I get to a point because, obviously if it's that much of a pain point and you've had that much time to process it and really even just go to therapy to work through these things and you're still not happy and you've tried everything to kind of make peace with yourself, okay, maybe there's a reasonableness behind it. But again, I don't want young people being so impressed by social media and all these other avenues that are influencing them to think like, oh, you need to look like this to be valued and to be a good person, or whatever it is they're getting in their mind that is desirable. Because when you have that, what happens when that changes? Or what if you go into the office and something bad happens, or you have a complication, or 10 years down the line, you end up regretting it? How much more damage does that cause to a young person when they haven't really even had the chance to really get to know themselves or develop that sense of maturity surrounding their body image?
Hmm. And you had talked about, some of your experience. Do you mind sharing some stories amongst the nurses that you've been helping and how you perceive or what your observations have been about their negative body image and how
Mm-hmm.
that influences just things? We're going to get into the sleep portion of it, but I'm curious about how that really morphs into just behaviors surrounding food and other things, because it's so important when you sleep to really, nutrition and sleep, all of these things are interrelated and they're all key
Mm-hmm.
things that really help to try to keep us on the planet as long as possible in as healthy a fashion as we want.
Yeah.
So, yeah, what have you learned?
So, I mean, just to add to your point about your own experience, I've seen this mirrored in a lot of nurses too, because a lot of nurses identify as female. It's a very woman dominant field. So, along with that, as women, we get married, we want to have children. Our bodies change over time. Like you said, my body's not the same as it was when it was 20, as it is 30s, 40s, and so forth. And that's absolutely true. It's a lie to tell somebody or have us all believe your body's not supposed to change. It is supposed to change. And there's a lot of different physical things that happen throughout our lifespan, especially as women. I mean, we are so much more metabolically complex than men. I'm just putting that out there. We're a different person every week. When we have, especially with our hormones, depending on what week we're on, it affects our mood. It affects how we act. I mean, anyone can argue with me on that. I mean, there's a lot of good stuff on that.
Would not. He would be 100% aligned, and he can tell.
Exactly.
Depending on how I tend to respond to certain things at a certain point in the week or in a week compared to a different week. You never know what you're going to get. That is for sure.
and to add to that too, like each week too, as your hormones fluctuate, women can also have different feelings about how they feel about their bodies. If you're about to menstruate, you're probably going to feel a little bit more bloated, or you might feel like, or your skin might be breaking out. So you might feel a certain way about your body during that point of your cycle versus a week later when your skin is glowing and you're no longer bloated. So even that can wax and wane from week to week, let alone decades, because your body, again, as I see with nurses, a lot of them are at that age where they're like, I want to have children, but I also don't want to gain an excessive amount of weight. I don't want to, have stretch marks, whatever that is that happens with pregnancy. And of course, it's natural. It is completely natural to have weight gain. You want to be able to nourish that child as it's growing. You're going to get stretch marks. That's what happens when you grow a life inside of you. It's a beautiful thing. But we're constantly being told by the media, oh, if you don't bounce back after having a kid within a month, you're not doing it right. And that's a complete lie too. Your weight is going to slowly and steadily, increase over your lifetime, and for a variety of reasons. It's going to go up and down. There's a bunch of studies, but also there's a bunch of different changes that we're supposed to expect. After the age of 30, for example, we tend to lose more muscle mass and tend to have that transition more into fat mass. And of course, there are ways to maintain your muscle mass and keep that going. But for most people, if they're not aware of this, or they're not exercising or practice certain lifestyle factors, of course, they're going to lose muscle mass. And for women too, as again, if they have children, they might see a change in how their hips are or how they carry their weight. Even as we get older and we start getting into like that menopause, you might see a little bit of changes in where your weight settles as well. You might notice some changes in your hair color. I mean, there's so many different changes that are supposed to happen through our lifetime that we're lied to, like, oh, that's not supposed to change. The weight that you're going to be at 18 is the weight that you're going to be for the rest of your life. And that's a complete lie. It's a complete lie. And a lot of women come to me.
It's just so true. Oh, man.
And a lot of women say the same things in these sessions. They're like, I used to be this, even just 3 years ago, like, oh, prior to the pandemic, I used to fit X size scrubs, and now I'm in this size scrubs. And I'm like, listen, think about what you've went through these past 3 years and how that's impacted your physical, your mental, and emotional health. Stress is extremely correlated with how our bodies are metabolically regulated. Also, like you're going to dive into the lack of sleep because of the stress or the mental distress that they went through during the pandemic. All these things, like you said, are interconnected. And of course, that plays into how we feel about ourselves.
That is so huge. Thank you. So we're going to switch gears a little bit, and now we're going to get in a bit about sort of the paucity, honestly, of data that's out there regarding body image and sleep. But I'm excited to see that people are looking into this because, as you can tell, we are talking about literally, I think, I don't know, a single young adolescent female who's going to grow up, be a teenager, be an adult woman who hasn't gone through some of this over the years. I mean, we've shared with you some of it, but I don't think anybody's never been touched by this. I mean, if you have
Correct.
access to, I don't know, the world, just living, even if you
Yeah.
didn't have access to television and modern technology, which is fortunate that everyone does, but also has the flip side of what we're talking about here. And now a quick break, but don't go anywhere. We'll be right back.
Struggling with sleep? Dr. Cole is here to help. Whether you need a comprehensive sleeping coach program, suspect you have sleep apnea, or simply seek a second opinion, she's available for consultations in New Jersey, New York, California, and Georgia, with more states coming soon. Schedule your free 15-minute consultation today to find out which visit is right for you at asktosleepmd.com and start your journey to better sleep with a trusted physician.
If you are liking this podcast, if you're finding it educational, if you are feeling more empowered to go to your doctor with any sleep issues that you might be having to address them, please, please, please lend your support. Make sure that you are liking, following, subscribing. I am available on YouTube. I'm also on Apple, Spotify, wherever you get your favorite podcasts. The website has launched. So we have askthe.sleepmd.com to be your free educational resource. We've added many new blog posts filled with juicy information. If you would like to support the podcast, we now have a way for you to donate. This is a labor of love. I truly enjoy what I am doing. It would be inspiring and truly helpful if you wouldn't mind even so much as donating $1 to keep this podcast going, particularly if you really find this free education a good platform for you and a good resource for you. I also have affiliate links for products that I'm a proponent of, such as Quiet Mind. So please check out the website, sign up, and you will get the latest news, the latest blogs, some sleep tips, and just have a great day and keep listening. Okay, guys, sleep well. But let's define good sleep. So when I think about good sleep, things that are important, we're talking about sleep quality and sleep duration. So sleep quality is really how you perceive you are sleeping. Do you feel like you feel rested? Do you feel like you got a good deep sleep? Do you feel like and then duration really is like, oh, have you gotten sufficient sleep? Did you sleep enough? Did you get those hours that are right for you? And I hear all the time, what's very interesting and we know is that people who don't sleep enough, if they're sleep deprived, they tend to make poor food choices. They tend to, it cascades into like more of a stress response because you're not really clearing out those evil humors at night. And it builds up. And most people who are sleep deprived, it could be because they feel the pressure to be sleep deprived. I've got to be here. I've got to do certain things. If you're a teenager, it's like, well, I've got to get to class. I got to do this, but I'm really like, I'm just not ready to go to bed before noon, but now I got to be up at 6 o'clock in the morning and my growing body still needs 8-9 hours of sleep and I'm not getting it. So getting enough sleep that's right for you. Again, generally speaking, we say that if you're looking at various health markers, I'll use cardiovascular risk, meaning heart attacks, serious sort of bad things that happen either because of heart attacks, strokes, heart failure, all those types of things. We know that the data shows that you're more at risk to have bad cardiac things happen to you if you sleep less than 6 hours or more than 9 hours. So too short, too long can both negatively impact you. So, in the essence, the reason that it's even important to think about these things is because I don't know any of you, but I can speak from my personal experience. And Marissa, I know you can too, because we all experienced it working crazy hours and just feeling overwhelmingly stressed during the day and then trying to wind down to actually sleep at night. When you do not sleep well, if you've been paged routinely overnight for multiple days in a row or done night shifts, you certainly leave with a decreased quality of life. Like I don't know anybody who's like, hey, yeah, I've like really not slept all that well, but I feel great. My quality of life is amazing. So we know that that's just not the case, right?
Correct.
So, I want to get in a little bit into the weeds about, some of the data that we have on body image and sleep. So, one of the things that I came across was a study that was done on adolescent girls. So there were like over 500 girls that were followed over time. And these girls were, what I thought was interesting was wasn't they talked about how you sort of viewed yourself. To your point, the body image, like what is your perception of yourself?
Mhm.
And these were, it didn't matter what the girls actually looked like or what size, quote unquote, they actually were, what their weights were. It really was,
Mhm.
okay, how did they perceive, they felt about themselves? This is a recent study, guys, by the way, 2022. And what they saw was that if you tended to be a person who overestimated, your body size, in other words, you're smaller, think you're bigger than you actually are. I will tell you right now, I have definitely been in that camp. No shame about it.
Mhm.
It's just I'm not in that camp anymore. I just accept who I am because well, things are very different in your 40s.
I love that
But
for you.
exactly. But if you correlate that and you look at, if either you think you're too big or you're just not happy with the way you look on, and that could be, sometimes it's the converse. Like you could have a thin person who's like, well, my boobs aren't big enough, or my butt's not
Mhm.
perky enough, or all these sorts of weird things that we start to think about ourselves. What they found was that these people who tended to have this feeling, they tended to spend a little bit more time on their screens, and they definitely did not sleep as well. They had poor sleep habits. So there is a correlation there, and we're seeing it even in the adolescent population. Um, I found something else on adult women and cutaneous body image. And I wanted to know if you knew much about that, because that kind of blew my mind. Because we, of course, in the context of nutrition and what you do in your expertise, have been talking really about body image in the global sense of how we quote unquote look. You
Mhm.
hinted at it, right? But people can actually perceive age differently. And what I thought was wild was when I was looking at this, there's been a number of studies kind of looking at this. And one of them was that if you gave people, if you took people that are actually sleep deprived and you just showed them to other people, they would rate the faces that were sleep deprived as less attractive, less healthy. They looked more tired, right? And what I thought
Mhm.
was even, this was a much smaller study now, but they looked at a small group of folks. Half of them had insomnia or difficulty sleeping. The other half didn't. And then what they did was, these people, if they were sleep deprived, they looked at themselves and they said, okay, here's a picture of yourself. Like, how do you perceive yourself? And the people who had insomnia actually thought they looked a lot worse, whereas the people who don't have insomnia did not perceive that they looked as bad. So it's as though the actual act of not sleeping well or the actual underlying insomnia actually kind of affects your self-image. What we
Mhm.
know is when you don't really see yourself in a way that's positive, that leads more to having depression and other mental health disorders. People who feel depressed because you look in the mirror, you don't like what you see, goes back to, now we're in this loop, because now it's like, okay, well, I don't sleep as well because I don't feel as good about myself, which makes
Mhm.
me look even worse because now I'm more tired, but then my perception of myself is even worse. It's like this spiral, this crazy shame spiral.
Chicken or the egg?
Oh my goodness. So I thought that was really crazy that when we talk about cutaneous, but it's really just your physical appearance, like wrinkles and do you look tired and things that I went into.
Mhm.
I wasn't sure if I really saw anything on actual physical body image. So I wanted to kind of turn that over to you and see if you had found anything on that.
So in regards to like actual physical body image, I know that even just from working with patients itself,
Mhm.
kind of like you hit the nail on the head where if you're sleep deprived, think how it impacts your mood. Think how it puts you at risk for mental health issues. Think about how you feel when you're sleep deprived. Like your mood overall is like you're negative, you're cranky, you just everything seems dark and gloomy. So when you look at yourself, you're like, ugh, like I'm gonna nitpick because I'm cranky. Like think about your mindset. Now, if you had enough sleep, I don't think anyone living in this current world that we live in, most people are not going to wake up in the morning and be like, gee willikers, I'm so happy to look the way that I do today. You know, it's not like that. That's not realistic. I mean, you can wake up in the morning and get a good night's sleep and be like, you know what? My skin looks pretty good today. All right, I'm going with it. You know, I think most people have that humbleness to them because society has given many, many women and men too, this idea that, okay, if you're close to the ideal body or you think you are, you can embrace it, but don't love yourself too much because you don't want to seem like you're full of yourself. So it's like, what are you supposed to do? Like, are you supposed to completely hate your body or completely?
I so get it. I so relate to this because,
like, how dare you?
I grew up really with it being emphasized that you don't want to have this like ego about you. You want to be humble. But I think it's very difficult to reconcile that whole idea like, hey, you're so vain because you care so much about this, as opposed to it's like, okay, well, I either really love myself and I'm vain, or the flip side is, okay, well, I'm humble, but yet I think at least I would make the argument, I think a lot of people, at least I could say for me, had to readjust what humble means. Like, I don't perceive myself as walking around like I'm the greatest person since sliced bread, but I do feel a lot better about myself as a whole. And I still feel like I maintain that humbleness, but it took a really long time to figure out that you can be someone who doesn't need to like put your accolades in someone's face or be like, I am the great, and you have to like sort of declare that type of thing. But at the same time, just being like, okay, but you know what? That doesn't mean I have to hate myself. For the longest time, I kind of felt like, no, if something great happened, it's the same idea of how, a little off the beaten path of what we're talking about, but I think still related. We have all these thoughts, right? I've read so many things, kind of like 10,000 thoughts a day or what have you, like some astronomical number of thoughts a day. And like 80% of them tend to be negative. And it's really sort of how we've evolved, because the negative thoughts have been historically protective. Like, hey, all right, I need to still be aware of my surroundings because what's going to come and attack me or what have you.
Correct.
And I feel like that, but because we're so sort of biologically geared toward looking for the negative, it's really hard when the positive happens. And I've always been, quite frankly, I don't know if envious is the right word, but admiring of folks that appeared to be able to take the positive, that little chunk of 20% that happens, if you will, and really latch onto it and be like, but this is so wonderful. And I'm always like, how do you do that? I want to be like that. I mean, for me, it's a conscious effort that I literally now journal and write down, this wonderful thing happened to me today, because it literally will evaporate. It'll be like, poof, it's gone. And then I've now focused. I've even had difficulty, and I don't know if you've experienced this working, with the patients that you have, but like difficulty even accepting compliments from patients. And meanwhile, and I'm like, there's nothing wrong with feeling like I do a pretty darn good job at what I can do. Like that I've really honed that skill set, but yet somehow it feels like I'm, the other like med student part of my brain, if you will, is like, you didn't think of everything. You were not perfect. You could have probably done that a little bit better. Like there's always in the back of my mind, like, how did I handle that? And it could have been done more optimally. Like this, like internal self-criticism. That's like, I don't know. It's like some weird, like mind meld, especially in just, I think in medicine in general, we're sort of taught that like, but did you do enough? Was that really sufficient? And kind of taking a step back and being like, oh my God, stop already. Like just own that. And for me, it comes down to a lot of hard work with self-love. I've had to really work at that, I think.
No, agreed. I mean, I think everyone has their own path and how they can get into a better space with how they view themselves, because frankly, all the avenues that we get influenced by when it comes to our body image, it's so powerful. I mean, you've just mentioned a couple right there, like how many different spaces or people or experiences in your life have you been told something about your appearance and how it just impacts who you are as a person? Like you said, your mom said something to you when you were a kid. Think of all the, different magazines you read as a teenager, all the different TV shows you watched, even kids today, like I said, social media, all these different like avenues just coming at you and pelting you with all these thoughts on how you should see yourself. And keyword is should. not necessarily what it is. Perception is, and like you said, you were talking about all these negative thoughts, like the 80-20. How you perceive yourself can be how you think about things. So, for example, if you truly believe that you love your body and that your body is great as it is, then you can believe that if you truly put your mindset into that. Kind of like what you were saying with the 20% of the positive and latching on to that. Perception and how you kind of put things out there can change your entire world, but it doesn't mean that it's easy.
Oh, I think that's the hardest thing that I have learned is what energy I put forth. And in other words, am I choosing to focus on the negative or am I choosing
Correct.
to focus on the positive? If I choose to focus on the positive, at least for me, I have found that with time and effort, and literally it's a day-to-day battle some days,
It is a
it
conscious effort.
it's a conscious effort to put forth more positivity. And I feel like I've noticed because I'm focusing more on the positive, there tends to be more positive that happens in my life. Um,
Absolutely.
how I perceive myself compared to, how I was in my 20s. I remember being young and people being like, as you get older, things are going to change. You really want to relish what you got when you're young, right?
Mhm.
And I would say that now in hindsight, I'm like, oh, now I get it. Now I get it. And I'm like, okay, my focus now, the mindset is less on, okay, I look a certain way or I'm a certain size or X, Y. I think, metabolism being different and being older and different responsibilities, different sort of energy levels to do certain
Priorities.
things, priorities, all of it wraps into, okay, am I doing the best I can today? And I take it day by day to try to maximize my health overall. And that
Hmm.
actually is framed even how I approach a workout, how I approach my diet, having learned a whole bunch of stuff, both from you and from Jackie, who I'm going to be interviewing later on this week from Lane Norton, because you introduced me to Lane Norton's
Hmm.
crew using his carbon app and stuff, which is pretty cool. And that's a shameless plug because it's good stuff. So you should consider it. And I don't know Lane personally or anything, but I believe that he is a very good product. And a lot of folks that I've worked with have been just simply wonderful, have been in the space or know that space. So thank you
Yeah,
for that.
he posts a lot of good information out there too, and I love that he's very backed with evidence-based science and just really states it like it is.
Exactly. So just in taking that thought, it's like I've come full circle with saying, okay, I'm going to focus just kind of on being healthy today and being just happy that I'm healthy. And that
Correct.
might be a harder ask of someone who's younger because you just don't have that longitudinal sort of, sometimes you just sort of need to live life before you figure some of that out. But it's
Absolutely.
definitely been a priority and a focus as I move into sort of the second half, if you will, of life on this planet. And I'm like, what do I want from the rest of it? Because I've been doing pretty good so far. And you and I both have taken care of people that are probably our same ages who have a lot more health
Hmm.
issues. So we also come from that perspective of being like, man,
Big
I am
picture.
lucky and I'm blessed. The bigger picture is like I'm doing all right.
Big
So
picture.
how do I make a better footprint and less focus on like I said, something very small and superficial and more on like the bigger picture, which I think helps keep you motivated to stay on track. I do.
Absolutely. Absolutely.
Have
I
you found
mean,
that with your nurses? Like if you kind of shift toward how do I make myself healthy as opposed to how do I be a size zero, I would think that that
correct.
would bode better in terms of your diet and how that works.
Well, you also have to ask each individual, like, what does health mean to you? I mean, not everyone's definition of health is going to be the same. And also to add on to that, when you were talking about how older people tell younger people, like, enjoy it now, I almost cringe at that because,
Mm.
like, you're supposed to age. And I know that we were just talking about how bodies are supposed to change over time. The same concept applies to aging. I mean, think of all the different products out there that are for anti-aging, anti-cellulite, anti-stretch marks, all these things like, oh, how dare you age? Everyone does it. I mean, we can all focus on our health and still gracefully age at the end of the day. I never understood that whole like doom and gloom that comes with aging. You can age gracefully. No one says it has to be all
I see.
like, oh, get ready. It's only going to get worse. You're going to get back pain now. You're going to get, like, I just had a birthday. And there's this whole joke that when you get into your 30s, it's like the end of the world. It's like, oh, now you're going to wake up with back pain. You're going to have knee pain. You're going to have crippling anxiety. And now hangovers are going to last 3 days. Says who? Says who? Because the last time I checked, I feel pretty good. I take care of myself and I practice health habits that I value and that add quality to my life and are going to help me age gracefully. So,
well, I will forewarn you that when you do hit your 40s, some things start to hurt a little bit more. And that is like, and so I laugh because I don't say that in a bad way. I say like, okay, well, I think I can just more relate to some of my older patients who have mentioned this over time, because these are conversations that I have often in the office. And I'm like, now I kind of get it. Now I kind of get it. And I do feel like there is a difference between 30 and 40. But to your point, I also don't look at it like, oh God, like I'm headed toward perimenopause. That's I'm trying to keep a better spin on it. Like, how do I shift my mindset? Because it was very fascinating. I was talking to my friend, Dr. Val, and we were talking about perimenopause and some of the hot flash symptoms that occur. And what I was blown away by was data that actually supported, believe it or not, just simple, almost like cognitive behavioral therapy, like meditation, a different way to like talk yourself down when you feel the hot flash coming on, that actually works really effectively. And I was like, there's such a deep mind-body connection, and we know that's all interrelated to sleep. And if we want to improve the quality of our sleep, doing smart things and approaching our lifestyle in a way that is going to promote sleep, I think is hugely important. So as we wrap up, I want to put all of this together. We have been, again, speaking mostly about folks in general in terms of related to body image, but I wanted to, before we get into some of our recommendations for you, just simply hone in on some of the more severe eating disorders that are out there. The reason I'm using those as an example and emphasizing them here is because that's the one area that we do know people really, their sleep really takes a nosedive. And what's very interesting is the more severe the eating disorder, like if you're more restrictive, if you have worse body image issues, you tend to sleep worse that much more. And there may be other components that happen. In that particular situation, there may be a component of malnutrition. People have been looking at things like orexin, which we talk about a lot in narcolepsy, but also helps to regulate our appetite and our hunger. And at least in animal models, so very, very limited data on that. There may be some relationship between what our levels are and us restricting our food, for example. And, basically, if you don't sleep well, that tends to increase your risk for having a sleep disorder. And if, having an eating disorder. And if you have an eating disorder, you tend not to sleep well. So I think of body image as being a sort of a milder form of that, because you may just have a poor perception of yourself, but maybe you're not doing some of those really harmful and dangerous behaviors of binging or, binging and purging or starving yourself or those types of things. But the bottom line is you had touched base on a lot of really, really important points regarding body image, which is it doesn't occur in a vacuum, right? So how we perceive ourselves has things to do with our upbringing. Maybe it's just our baseline predilection for taking in more of the negative, less of the positive. Maybe it's social conditioning. Maybe it's social media. Maybe it's our influences outside of ourselves. There are a lot of things that kind of influence how we perceive ourselves. If you had, I'm sure you're probably doing this because not only you're giving nutrition advice, but you obviously have to deal with these body image issues. So you're obviously providing a tremendous amount of education to your patients. Are there any other practical tips that you want to leave our listeners with on how to sort of reshape how they feel about themselves? Because if they do that, and I think we've touched on some of these things, but if they do that, I truly believe that their sleep will improve because they sort of are just going to feel better overall. I
Yeah,
think it could really help with their mood and all of that. So
absolutely. So one of the things I usually like to tell my patients or my clients is to remove any social media like pages or people you follow on social media, anyone who makes you feel bad, negative, like you're comparing yourself to them, any negative behaviors or mindset surrounding that page, remove them.
I
It's
love
not
that.
benefiting you. Just get rid of it. Like it's not going to change things for you. The other thing I would say is if it's such a heavy pain point, as a dietitian, I can only go so far within my scope of practice in regards to body image and mindset reframe. So I always recommend mental health therapy because that can be a huge game changer in helping you achieve that peace with your body. Because everyone at the end of the day deserves peace with their body. And then the other thing too is to consider even getting to a place of what we call body neutrality, meaning
Body
that
neutrality. Okay.
instead of going, it's not like there's that whole toxic positivity where sometimes you're like, my body is great, even though you don't feel like it, the fake it till you make it motive. I wouldn't say that that can always be a good avenue for somebody to go down, especially if they really don't truly feel that way and it doesn't help them feel any better or help them get closer to a more positive mindset. So even if we can get you to a space where instead of thinking negatively about your body, you're just kind of neutral. You're like, you know what? This is my body. That is it. This is what it can do. Just letting it be. So body neutrality takes a little bit of time and practice, again, with the right practitioner who's trained in this. Also, again, mental health therapy can be a huge deal when it comes to that. But even if we can move the needle just a little bit, doesn't have to always be in the positive space. Even just body neutrality can be a huge game changer for somebody. And last but not least, like just try to be patient and kind with yourself because it's a lot of deprogramming to do, especially like the older you get. I've had patients who are close to their 70s and I'm helping them deprogram 70 years worth of thoughts. And that's what they are.
Wow.
They're thoughts. So one thing I always like to tell my patients is to consider just instead of, if you don't have the energy to constantly battle your thoughts or argue with yourself, you have two avenues. You can let the thought come through your mind and argue with it and with facts, not emotions, or you can just look at it and just let it pass. Don't respond to it. Don't
Like a
react to it.
screen door, right? Right
Mm-hmm.
through the screen. I think a friend of mine used that analogy and I really loved it. Like a screen door.
It's like when you meditate and you don't want to, you kind of judge yourself. Why can't I just get into this Zen zone and not think of anything? Usually you'll hear from teachers, they'll say, don't judge yourself. Just let the thought come up and let it pass and then come back to your center. That's it. And that takes a lot of practice too.
That is huge. Yes. And if you're looking for other ways to set yourself up for success regarding sleep, we've been talking a lot about the mind body connection. And I think this has been such a fun episode because it's not just like fact based as a sleep disorder. These are things you need to know about it. So it's getting more toward being a little bit more off the beaten path, which is always such a fun journey for myself. But, um, you know, when you're thinking about quote unquote sleep hygiene or setting up a sleep friendly environment, it's the same attitude that we should take in how we approach health in general. You start by making it a priority, just like making your nutrition a priority, making movement a priority, and maybe starting with that, again, a place of neutrality where you're not judging, hey, I look a certain way when I do this or that. But also how you approach sleep. There's no right way for everybody. It's not a universal thing. But there are certain things that as human beings, we can all do to optimize our health. So
Mhm.
if your room is really bright and it makes it hard to wind down, maybe you live in a busy area with a lot of bright lights, for example, make sure you have room darkening shades. Or if that's, not affordable, you can just, get some dark, dark
Like
sheets or what have
sleep
you, and you can
mask.
hang those up. Sleep mask, even easier, right? And there's a whole bunch out there. if that's your thing. You want to make the environment somewhat quiet. You want it to be cool, roughly 68 degrees. I like mine at 71, so I don't debate all the rules. But I'm just saying that's for me, that's ideal. But some people might be a little bit cooler.
So thank you for having me.
Disclaimer. The statements made on this podcast have not been evaluated by the U.S. Food or Drug Administration. They are not intended to diagnose, treat, cure, or prevent disease. The information provided by this podcast should not be used as individual medical advice. While I am a practicing sleep provider, I am not your sleep provider. You should always consult with your personal healthcare provider for individual recommendations and treatment.